Hi there, Casey here from Action Potential. I am one of our pelvic floor physical therapists here, and I wanted to talk to you today about male pelvic health. If you've been following us for a while, you're probably pretty well aware that we treat anatomical females with pelvic health conditions. However, you do not need to be a vagina or uterus owner to qualify for pelvic health. If you are a human being, you have a pelvic floor, you have a pelvis, and that certainly includes all of our anatomical males out there. So there are a variety of reasons why a male may find themselves looking for a pelvic floor physical therapist, and this could include things like bowel or bladder dysfunction, so talking about incontinence, urinary or fecal incontinence, any sort of urgency or frequency in toileting habits, constipation, hemorrhoids. That pelvic floor just creates the outlet for your gastrointestinal system. So if you're having problems on that front, it may be indicated that your pelvic floor is involved in part of that dysfunction. Another reason why males specifically would need a pelvic floor physical therapist would be including issues with the prostate. So any sort of chronic prostatitis, prostate surgery or removal, all of those things may be indicative of a pelvic floor screen from a physical therapist. Surgeries aren't just limited to the prostate. This could include if you are someone with multiple abdominal surgeries, hernia repairs, maybe some extensive surgery to the hip, the groin, possibly even the low back, especially if your post-op status includes bowel or bladder dysfunction or pain, which I'm going to talk about in a moment as well. And certainly if you have any sort of trauma to the pelvis, so if you have a pelvic fracture, a coccyx injury, you may need pelvic floor PT too. Pain is certainly a reason to come in for pelvic floor physical therapy, and pain for pelvic health could include any sort of genital pain, pain with sexual activity, pain with bowel or bladder voiding, but this can also be including hip pain, groin pain, low back pain, especially if you've had these issues for a long period of time and maybe they haven't been responsive to more traditional orthopedic physical therapy approaches. It may be something that pelvic floor physical therapy can help with. That pelvic floor has a really close relationship to the low back and to the hip, so sometimes pain can refer elsewhere. And this is one of the reasons why when you come in for an assessment, we'll do a pretty comprehensive screen as part of your first visit. So we're not looking only at your pelvic floor, we're also going to look at how are you moving, what's your range of motion like in your spine, in your hips, what's your strength look like in your core, how are you able to transfer weight and pressure throughout your whole body system to see how things are moving together. And in that first visit, depending on what we find, and a pelvic floor assessment further may be indicated. So this could include some sort of external palpation or screen to that genital area to see how the pelvic floor is responding, to see how things are feeling, and may include an internal assessment via the anorectal canal to get a better idea of how are those muscles functioning. Are you able to get good coordination of those pelvic floor muscles to best serve you as you move throughout the day? So I think that touches on a lot of the different points that some of you may have questions about. If you have any further questions or concerns that you want to talk about, we do offer free consultations. I would love to talk to you about it more and see what ways we can help you.